Hello, my name is Dr. Riffat Sadiq and I'm going to talk about elderly care today on my channel, RS channel. This week episode, we are going to talk about the signs of strokes. So everybody know what stroke is. So we are going to talk about how our loved one can get affected if we don't do things at time. So what is stroke? Actually, stroke is when our brain does not get enough blood supply and blood carries oxygen. So what happened? It's just like a plant. If we don't water the plant would be dead. So there are warning signs. So we have to be really very, very careful. We have to actually watch for these signs. We should not ignore this. It's just like a plant. When we don't water, it first get like yellow, and then slowly it will be dead. If there are simple small strokes, those are kind of not that dangerous, but the major strokes, when people like sometimes have the half of the body is almost, you can say, dead, doesn't work. People lose their vision, their speech. So some of the strokes can be very, very dangerous, but some are the, like we call it mini strokes. So what are the signs which we should be watching? Sometimes people will have just confusion. All of a sudden they will be confused. And sometimes they are just numbness, only in one hand or two hands. So numbness is the one of the reason you will see that sign. And sometimes they will stop speaking. Speech is the problem. So I've seen many patients who will have just sometime a stare. They will not have any sign, but just a fixed stare. That can be a simple sign. So we should not miss any signs. If we catch the stroke on right time, we can save people's life. We can save their ability to live the normal life. I recently had an incident in my own family where the person was having just stroke symptoms and was taken to the hospital on the right time, and life was saved. No symptoms, no side effect, no after effects of the stroke. So taking care of the patient on right time is extremely important in stroke. Time is the most important thing. So I'm going to advise all people around who is listening that if you see your loved one who's having any kind of symptoms, which is you think it's a stroke, you do not wait. Call 911. And also you need to see what are the problems. We have to do some preventive measures why people will have the stroke. So number one on the top is stress. A lot of time things happen because of the stress. So we need to learn how to manage our stress. Number two is high blood pressure. High blood pressure sometimes give you small little strokes. You would not even know that. But one day it will give you a big stroke. So blood pressure control is extremely important. And the next thing is diabetes. So diabetes, people will have silent strokes. So because with diabetes, your nerves get so damaged that you will not have any symptom. So we have to take care of our health. We have to go to the doctors at least yearly for healthy check, have your heart check, have your nerve check, do the preventive screening. Also, you will be your own doctor. You are your own doctor. You see your body. If you see anything different, please go to your doctor. Discuss with your doctor, because these little things, if you catch on time, you can have a productive life instead of having a crippled life. Because if you have stroke, you will not be able to do the daily things which you otherwise will be able to do it. So if you want to have a good, productive life, I would suggest pay attention to yourself and also take care of yourself. Thank you for watching.